Hello and welcome to my health blog, direct from doctor. My name is Dr. Shanai. I hope you have seen my previous videos. If not, please go back and watch them, like them, subscribe, and help me grow my channel. Also, please ask your friends to subscribe. In my channel, I'll be giving a lot of tips on various health issues, common health issues, and some tips and tricks. So please stay tuned. So today I'll be discussing about what is called as fatty liver. Fatty liver. So fatty liver in the earlier days, nobody was paying attention to. I mean, the common people, they were not paying much of attention to fatty liver. But these days, because of the internet and various blogs, various health channels on the TV, and other things, it has become quite popular among the people. And I usually see what happens is these days doctors advise a lot of scanning, particularly ultrasound scan for small issues, which is usually not necessary unless there is a real problem, clinical problem. But most of the doctors nowadays have a tendency to prescribe. So the patient goes to the lab or a radiographer and gets ultrasound done, and the radiographer says, you have fatty liver. See, actually what has happened is, and most of the people have fatty liver. Fatty liver is one of the most common things. If you understand what is fatty liver actually and what it does to you, so you can actually be rest assured that you can stay safe without any problem. See, in fatty liver there are varieties. There is something called as non-alcoholic fatty liver, and there is one more called as alcoholic fatty liver. So in non-alcoholic fatty liver is very common, and in that there is something called simple fatty liver. A simple fatty liver is usually found in the ultrasound scan, and sometimes the doctors may scare you, and they may say, please go for the higher investigations like CT scan, MRI, and all that, which will not be necessary usually unless there is a real issue, real health issue, what is going on. So in the non-alcoholic fatty liver, so what happens is, as you eat more than what is required, the food, most of the food will get converted to fat. Whatever the carbohydrates, and they will convert into sugar, glucose, and also the fat. So what happens to this fat? And you eat fat also, from the oil and other things. Say all the vegetable oils have got high amount of triglycerides, so which is nothing but a fatty thing. So what happens, the excess of that, the required amount will be utilized, but excess amount, what happens to that? The excess amount will get accumulated in the liver, because liver is the one which metabolizes all this stuff. Liver is a fantastic organ which has got more than 300 functions, a lot of them. So liver usually metabolizes fat. So what happens, it metabolizes, and wherever necessary it sends through the blood, and the cells will get whatever is due for them and the tissues, and rest is stored in the liver. This shows up as the fat in the ultrasound scan and any other kind of scan. So this particular thing, it may sound scary because the doctors will try to scare you, unfortunately. Some of the doctors, not all. So if you are not an alcoholic, if you are a moderate drinker or a non-drinker, if you are eating a little too much, so then need not worry about that. This is completely reversible. Say, certain amount of fat should be there in the liver, right? Like any other organ, some amount of fat has to be there, surrounding the liver. But too much of fat, no, of course. So later it may lead to scarring, and it may lead to inflammation of the liver cells, which is not good. That is quite an advanced stage. But a simple fatty liver, nothing happens usually. It's reversible, and usually it doesn't show any symptoms. See, most of the fatty liver, they don't show any kind of symptoms. But once the symptoms start appearing, like nausea, skin irritation, a lot of other things are there, which I'll bulged tummy, we call it as ascites, fluid collection in the belly. We call it as ascites. These are all symptoms of liver disease. So those are all the advanced type, advanced type. So, and if this particular thing continues, particularly in the alcoholics, where there is a alcoholic fatty liver, so this may continue and this may remain in the liver, may not get eliminated, and this may lead to inflammation and ultimately scarring and hardening of the liver tissues called as cirrhosis. Cirrhosis, in the beginning it may be reversible, but in the advanced stages it's not reversible. It's a very serious disease, and very rarely in some patients it may cause liver cancer, but that's a very advanced type of thing. It doesn't happen in everybody. See, if you don't have any particular symptoms, just a bit of fatty liver, don't worry about it. See, doctor will always test. They'll do the physical examination and certain smaller tests, blood tests they may order for, and a liver function test, bilirubin, and so many things related to the liver and bile, and they'll find out that there's nothing much, not much of a problem. They may also test how much is the cholesterol level and how much is the triglyceride level. All these things they may test and see if any treatment is necessary. If it's not necessary, they will say, they'll ask you to cut down on the do a bit of dieting. A bit of dieting means you may be ordered to reduce the intake of fatty things and also the carbohydrates. So when you reduce, what happens is naturally the liver will send it back to the blood for utilization, whatever is stored in the liver, and it gets rid of that fat. Not completely, a little will remain inside the liver, or outside the liver and surrounding the liver cells, but it will remain as a harmless thing. Like any other, say, every organ has got a bit of fat covering that, so nothing to worry about. So this is a bit of information about the fatty liver, because a lot of people are concerned these days about the fatty liver, that my ultrasound scan says that there is a fatty liver, and doctor has said, or the radiologist has said, and is very serious. Not in many cases, very few cases where there is too much of deposit of fat, and also there are clinical symptoms. There is a big list of symptoms what the patient will experience, and only in that case a bit of treatment is required, otherwise not. So don't be too scared. If you are non-alcoholic type, don't worry at all. It's completely reversible, totally reversible. You can get back to normal with a minimum amount of fat in the liver. But if you are an alcoholic, then a bit of concern is, and doctor may order for several tests and see if you have any advanced liver problems like cirrhosis, like scarring, which is easily found out these days in scans. And also very rare cases, liver cancer, which is very rare, I can say. If you are a non-alcoholic type, usually it doesn't occur, but we can't say. Certain types of repeated infections in the liver sometimes cause cancer. Even what is called as repeated hepatitis A and hepatitis B, which I'll talk someday. Repeated attacks of that, it may convert problem into cirrhosis of the liver, or called as a hardening of the, or scarring of the liver, and also the cancer. Very rare. So this much information I wanted to give today. So don't bother, don't be scared. In fact, don't be scared about any condition. Always there is a solution. Okay, so be cheerful, lead a healthy life, eat well, but in the limited quantity, digest well, and you should be good always. Stay healthy. See you in the next vlog. Bye.